and a very warm welcome to each one of you who has joined us today from the length and breadth of the country for our third webinar in this year, and actually the second webinar in the series on the Nurturing Care Framework. I, Rekha Sharma Sen, on behalf of the Association for Early Childhood Education and Development, welcome all of you to this webinar. For those of us who had joined the March webinar, we had conducted the webinar on the Nurturing Care Framework and its application to typical child development. As we know, the Nurturing Care Framework is a framework which tells us how to best look after the optimal development of young children within the first 1,000 days, especially, and all during the period of early childhood. So today we shall be focusing on how the Nurturing Care Framework helps us to understand and foster the optimal development of children with disabilities. And our specific focus today will be on children with autism. And to take us on this learning experience today, we have with us the eminent and renowned developmental pediatrician, Dr. Samir Dalwai, whom you can see, and who practices at the New Horizons Child Development Center at Mumbai. A very warm welcome to you, Dr. Dalwai, and we are also very pleased to welcome to you as a friend of the Association for Early Childhood Development and Education. The Indian Academy of Pediatrics, as we all know, is a reputed academy of significant pediatricians all over the country. And Dr. Dalwai is the treasurer of this academy. The significance of this academy is that it launched the National Program on Nurturing Care for Early Childhood Development in 2021, and Dr. Samir Dalwai was appointed as the national coordinator of this endeavor. In the next 2 years, in spite of the COVID situation, the Indian Academy of Pediatrics conducted 180 workshops and trained 6,200 pediatricians across the country on early childhood development. Following the success of this initiative, Dr. Dalwai was invited to contribute to the World Health Organization's meeting on developing a toolkit for Nurturing Care Framework in Geneva in November 2023. Right now, the IAP, that is the Indian Academy of Pediatrics, is collaborating with UNICEF on inclusive ECD, which extends the Nurturing Care Framework to children with autism. And it is in this context that today we will be inviting Dr. Dalwai to talk with us. But a moment before Dr. Dalwai takes on the stage, I'll be requesting Vaibhavi to please put on the slideshow using which we will introduce our association to some of you who may have joined the association or who may not have known about the association till today. So the Association for Early Childhood Education and Development, it's a registered body at the national level, and it also has its branches. And it actually started in 1964. The idea was to bring together professionals in the field of ECC together to work for the young child. It started in the Lady Irwin College in the Department of Child Development in the presence of eminent educationists. And those of you who would remember, it was called the Indian Association for Preschool Education at that time. And its purpose was to organize workshops, refresher courses, annual conferences, etc. Over the years, what has happened is that AECD has worked with government functionaries both at the national and state level. For example, we provided inputs on recommendations to regulate ECC centers in Maharashtra. We contributed to guidelines, framing of guidelines for creche and daycare services in Maharashtra. At the national level, AECD provided inputs on the draft national education policy when it was being formulated. We were supported by the NCRT, and we are part of, the members of the association are part of various government bodies, committees, for example, related to the ICDS or the Ram Joshi Committee to Review Preschool Education in Maharashtra state. In 2008, the IAP took up a new avatar, and that is when it came to be known as AECD, which we know today. And so the AECD also expanded its mandate using a rights-based approach. And besides teachers and working with parents, it also aimed to reach out to other stakeholders in early childhood education. as we know that in the 21st century, it is the early years of the child which is going to be the strength of any nation. Our national office is the Tata Institute of Social Sciences in Mumbai. We work on advocacy, we organize conferences and seminars. And let me tell you that our latest conference is going to be there in November in collaboration with the University of Rajasthan, and it is on foundational stage education. So those of you who are interested, do keep looking out at our website for latest updates on that. We have webinars, teaching resources. We welcome opening of new branches if some people together would like to do that in the state. And we network with organizations in the field of physical. The branches specifically provide refresher courses, networking, professional development workshops, and a host of other information and e-resources are also available. We also provide an e-newsletter, and this is sent to all the members who are registered. And if you have any good practices in your school, we would request that you please share those with us so that we can share the same on our e-newsletter. And if you would like to know more about the Joy of Parenting program, this is something that we do with the Balamandir Research Foundation, and we strengthen the schools to conduct parenting, because the schools and the parents have to work hand in hand to work with for the welfare of the child. May I request all those whose mics are open to please mute those, as it is causing a disturbance. Dr. Geeta and Dr. Rakhi, requesting you to please mute your mic. Dr. Rathore and Dr. Rakhi, kindly mute your mic. We conducted a conference in 2022. I think Vaibhavi, you can remove the people, otherwise it's going to cause a problem to the people who are listening on the YouTube. Vaibhavi, kindly remove the people who are not muting their mics. Yeah. Because it doesn't matter if I am interrupted, but if Dr. Dalwai gets interrupted, it would be a very, very unfortunate situation. Requesting Dr. Rathore, Dr. Rakhi Sharma, whom I can see, the mics are not muted. Could you please mute the mics? So we had a conference in 2022, and the association has published a book which is available through the Amazon also. It's on reimagining and reshaping early childhood care and education in the new normal. Both teachers and educators in universities and schools would find the book useful. Feel free to order for it directly. If you would like to join us, you're very welcome. We have our membership, 1 year, 3 years, and 5 years, both institutional and individual. You can download the membership from the website. And we are available also on Facebook. We are available on the Twitter. We are available on a host of our websites, LinkedIn, YouTube. Oh, sorry, we are not available on the Twitter yet. You could call up Dr. Purnima Contractor and Vaibhavi Pandya for more details about how to join us. And now I would like to invite Dr. Dalwai to talk to us about how the nurturing care framework can be applied to work with children with disabilities, especially those with autism. Just a 2-minute introduction to about what he's going to talk about. Many of us as teachers may have special children in our schools. Some of us may be parents of children who have disabilities. And we may have had many rounds of therapies or visits to the doctors. And most of it may have left us still confounded. We may be feeling more tired than empowered. What is it that we can do to strengthen the development of our child? That might be a question in our minds. And Dr. Dalwai's answer to that is that we need to look at solutions in our own context rather than importing Western solutions. And he has years of work behind him, with which authority he is going to talk to us now about approaches that have worked in the context of our own children, in the context of our own settings to enable the development of children with autism within the context of the nurturing care framework. So Dr. Dalwai, over to you.
Hello, good afternoon. Am I audible?
Yes, sir, you are. But if you could be a little bit more, if you could get your voice a bit louder, it will be even better.
Is this better now?
Yes, somewhat.
Yeah, please tell me if the volume is not good enough. Is this better now?
Vaibhavi, do you think the volume is all right? To me, it seems.
Sir, if you can be little louder, it will be better. The volume is actually coming very slow and low.
Blame me for screaming then, because I'm
Yeah.
just the maximum volume.
Perfect, sir. Done.
Okay. All right. So, Dr. Rekha Sharma sir, ma'am, Dr. Udma Contractor ma'am, respected Dr. Vrinda Dutta ma'am, all the respected seniors, teachers, professors, many of whom I've had the opportunity to learn from across all these years. And so many of the people who are attending here have been personally involved in my development as a developmental pediatrician. So thank you so much. And this again is the second talk that we are having with AECED on the context of nurturing care. And I think the last one which we had, again, thank you for that opportunity. We had spoken upon the principles of nurturing care with respect to how it can be modified in India or used in India, because most of the literature that comes in is basically what is called weird literature, WEIRD, for weird standing for Western, E stand for educated, I standing for industrialized, R standing for resource rich, and D developed countries. So what exactly should we do in a country like India, where the situation may not be exactly the way it is in these Western countries, because the situation there is completely different, and the situation what we have in India is completely different. So we had a long discussion on that, and I think it went very well. The fact that I've been asked to give another talk probably shows that. And I'm going to talk today about a topic which has, to be honest with you, has possessed me for the last 21 years. So when that happens, there is only two things. Either it can be very good for the subject and very bad for the person, or it can be the other way around, very good for the person and very bad for the subject. We leave that to all of you to decide. So today, on behalf of my New Horizons Child Development Center, an organization which is 21 years old, with 120 people working together, developmental pediatricians, physiotherapists, occupational therapists, speech therapists, psychologists, special educators, speech therapists, geneticists, pediatricians, and thousands of patients over the last 21 years across six, soon to start the seventh center at mine, and more importantly, post-COVID, an online division now which has no geographical boundaries but caters to children from almost the entire world. So, with the experience and with the sharing of knowledge from all of these sources, I am going to present to you what has been our experience in the last 21 years, specifically concerning children with special needs or children with neurodevelopmental disorders, and how the understanding of nurturing care for families with children with special needs can be looked at in a new approach in India rather than just looking at what the Western world is doing. And how do we go from there, from a physical center, physical help, to an online intervention? Because I'm aware many of us are representatives of schools or organizations which are outside of Mumbai. And how then can we share our knowledge and our services and help each other and the children that we serve? So thank you so much for that. And I'm going to try and do this topic in the following outline so that it's easier for all of us. What is the current situation, awareness, and the intervention, and the outcomes, most importantly, of all these situations? Is something going wrong? If so, what is autism there? Then, because this is World Autism Week, Autism Month, we just finished Autism Day. So I'm going to keep autism as a prototype of neurobehavioral disorders, neurodevelopmental disorders. And very importantly, can India look at any other way of doing this rather than just copying the Western prescribed interventions? And if there is another way that we are practicing at New Horizons, is there any evidence, or is it just theoretical that we are claiming it? Finally, can this be scaled? Can it be available to everybody else? Can it be available to schools, for instance? Can it be available to preschools, for instance? Can it be available to a preschool in Arunachal Pradesh, for example, or the Maldives? So can this be scaled? And finally, if that is so, what is the way ahead that we can all look at it going ahead? I think the way ahead is to begin with the current situation first. What is the awareness, intervention, and the outcomes of children with special needs? I'm going to show this research data here. And this is from our centers in 2013 to 16, 4 years of research. We had about 2,964 children to be exact, to be precise. Look at the age. Can you just mute everybody, please?
Right.
Yeah, so the host will have to keep looking out because as new people join, they may not be aware to mute themselves. All right.
If he,
So,
I will take.
all right. So this shows us the average age at which children were coming to our centers as late as 2016-17, not more than 7-8 years back. Can you see the age? Just one of you can, Priyanka, Purnima ma'am or Rekha ma'am, you can just unmute yourself so that we can have at least a tete-a-tete. So can you see that the age at which children were being referred to a developmental center was above 6 years of age, between 6 to 7. Today, our data shows that children are being referred by us between 2 to 3 years of age, and a large number of these children are being referred to us by schools and preschools who are picking up children with difficulties earlier. Are you able to hear me? Is there an echo?
Yes, sir, we are able to hear you.
All right. So we are seeing children referred largely from the schools because the schools are picking up children with some problems and referring it to the developmental specialists. Or even more entrepreneurially, now schools have started having therapists and so on and so forth in their own school. So the point is that awareness has increased tremendously. You must have got 100 messages in the last 5 days regarding Autism Day and Autism Day awareness, if I'm not mistaken. And you've seen signs and symptoms of autism and early intervention, early intervention, early intervention. You've been doing that. You've been sending children. Children are coming for early intervention. More children than ever before in India are taking interventions. And more children are taking intervention for a longer period of time than earlier. But the question is, what is the outcome? If the awareness, the interventions, and the services provided and taken have increased humongously, has the outcome increased humongously? Have more children with autism become neurotypical or normal, so to speak? Or are they still struggling where they were earlier? Is there any improvement? Is that improvement substantial? Does it substantiate the effort that parents have taken and the amount of money they've spent to get there? My answer is sadly no, because this is a situation that still comes up today. And as things stand, अभी किसी को अगर भेजना नहीं, as things stand, a 3-year-old child is seen by you in your clinic or in your school. The only complaint that the parents have or you may see in the school is the child has delayed speech, is not speaking. Many of the people may be refusing these children in the so-called interviews before admission. But when as a doctor I probe further, the mother tells me, yes, we doctor doesn't sit in his place. In fact, that's what the teacher in the school was saying, that he keeps moving around all over the place, disturbs other children, does not respond when called, but says nursery rhymes, names objects, vegetables, shapes, can do shape sorting, solves puzzles, matches colors, and says good morning, but all day. He says good morning in the morning, evening, afternoon, at night. But he does not interact with peers. That's what the school says. So what does a parent now come to me? The school has sent us to you, doctor, but we are very clear what we want. We want a certain therapy for speech. We want another therapy for hyperactivity. We have been told behavioral therapy is good for behavior. There is something called sensory therapy which we are seeking all over for sensory issues. Americans are very fond of ABA. Are you American enough? Are you westernized enough, educated enough to give us ABA in your center? Of course, we need remedial educators all the time. And also, we need a shadow teacher for allowing the child to go to school. And as a development pediatrician, we only wanted to agree that our child does not have autism. That's all we want to hear from you. Or worse, if you do think it has autism, then can you work as a traffic policeman, Dr. Dalwai, to direct my child to the above services? Can you be an agent, basically, to refer me for these services? If you see, this is a scenario that you are spoiled for choice. And there's a false sense of happiness or even bravado, I may say. Oh, we have so many interventions for autism, so many things that we can do, so many aspects available all over, from human therapy to animal therapy to every kind of therapy. And as a doctor or as a school, You probably are spoiled for choice. Where all? Which should I choose? Hina, Mina, Mina, Mo. Whom should I send to? This is the situation, unfortunately, that I saw a day before when I just was talking to somebody else. A parent came to my center, the parents and grandmother, a 6-year-old girl child. She has been on a particular therapy for 3.5 years, 2 times a week. Plus, in the school now, she gets it twice a week. This is outside. Speech therapy since 3.5 years, 2 times a week, plus once a week in the school. Remedial education started 2 years back, 5 to 6 days a week, which is ongoing. And at the end of the day, after having done this for 3 years, spent not less than 2 to 3 lakhs per year. This is what they have got in the child. So now the child has all these things that she has shown. There is still a speech delay. There is inattention. There is hyperactivity. There is aggression. Look at the behavior that this child is exhibiting in the doctor's clinic. She has no idea how to behave well. No speech, temper tantrums, crying, throwing things, hits others, sits in a W position, rubs her perineal region on the bed since 1 year. She has hand flapping, stimming, inversion of foot while walking, spinning around. She claps when excited. But eventually look at the situation that's happening here. So my question is, parents asked me that the doctor, you all told us, I mean, whoever they had gone to do all these kinds of interventions without arguing. We did it as long as the school told us to do, as long as the doctors told us to do, as long as the professionals told us to do. What is the result? Why is this the result? Where have we gone wrong? My thought was they haven't gone wrong, but the question is, have we gone wrong? And are we setting the right goals for these children? When all these therapies and all these interventions and all these medicines are offered, are we actually setting the right goals? And hence, when you look at it ahead, going ahead, what actually went wrong? What went wrong is that this child got all these therapies. Today she sits, but only to do shape sorting, puzzle sorting, matching colors. She speaks, but only to name vegetables, shapes, day of the week, so on and so forth, or wishes good morning to everybody throughout the day. But she can never be taken to anybody's house. Without the mother, there is no question. And most importantly, she can never be left with the bua, the chachi, the masi, the muani, the mami, the fupi, without the mother, even for 2 hours. So nobody wants that child. And actually, the parents also don't have time because they're busy at home practicing what they were taught in the class, basically shape sorting, puzzle sorting, reciting rhymes, teaching names, so on and so forth. So, what went wrong is the second part of what I'm going to come to. What has happened is in the last 3 4 years, with a great interest to do the best for these children, in a very innocent way, all of us have created a lot of awareness about how to suspect autism. And I'm sure you must have received about 5 10 pictures like this in the past few days because of autism awareness. Child who prefers to be alone, doesn't speak, doesn't respond to name call, has repetitive behaviors, avoids eye contact, doesn't want to go to crowded places, doesn't go to relatives' house, doesn't go to birthday parties, can't understand what people say, toe walking, sensitive to loud noises. We know this. We know this is how you suspect child with autism. And then what do? You refer for these interventions. You refer to the developmental pediatrician, or you start these services in your own school. But the point is, what do you see and what do you do? You see a speech delay, you start with that training. You see a behavioral problem, you send for that. You see an academic problem, you send for that. This is very akin to this. As a doctor, if I see a child with headache, nausea, high fever, chills, I won't prescribe headache therapy. I won't prescribe high fever intervention. God forbid if I prescribe nausea intervention or applied muscle analysis for muscle aches. I don't do any of that. What I do is I examine all the signs, I look at all the symptoms, I come to an etiological or the causative diagnosis. I don't keep staying on the symptoms. I analyze the symptoms to come to a diagnosis. And then, if the diagnosis under a microscope I see a malarial parasite, or I grow in a blood culture the typhoid germs, I actually treat the cause. I treat the anti-malarial with I treat the malaria with an anti-malarial. I treat the typhoid with an antibiotic. And if the cause gets better, the disease gets better, the symptoms go away on their own. What happens is, Unfortunately, in neurodevelopmental disorders, we get caught up in only observing and analyzing the individual symptoms. Oh, she's not speaking because she's shy. Oh, she's scared of the teacher. Oh, she doesn't like to speak when men are around. Oh, this child is not hyperactive. He's like that. All boys are like that only. They are all hyperactive. The father was also hyperactive. And hence, you avoid therapy for hyperactivity. You prescribe therapy for hyperactivity. You want to work on speech. You want to work on repetitive behaviors. So what are we doing? We are actually advising symptomatic therapies. And this is the fact which all of us must accept because it's a reality. All of us are now rushing, forget sending to a doctor who then refers to them. In our own schools, now we have conveniently seen a great new service for children. Whether it is a service to the children or to ourselves or to the business is another question. We'll come to that. But symptomatic therapies. Now, what do you see and what do you do becomes like this. For each symptom that you have seen, people are coming up on a daily basis with newer and newer therapies. For this, do that. For that, do this. छींके आ रही है तो ये खाओ, खांसी आ रही है तो वो पियो, उल्टी हो रही है तो ये दवाई लो, और जुलाब हो रहे हैं तो वो इंजेक्शन दे लो. We are all obsessed with finding newer and newer solutions. For what? For the symptoms. Only giving symptomatic therapy. So now you have hyperbaric oxygen, you have ozone therapy, you have stem cell therapy. Most interestingly, you have animal therapy. That's what somebody told me yesterday, that their therapist is also giving animal therapy. So in the price of one, they are getting two therapies. Wonderful. There are n number of people who come and tell me, the doctor, we do one therapy in the morning, 5 days a week with one person because she's not very good. But 5 days we go to her because somebody said we need this therapy. But there is one person who's the best in this field in the city. So once a week we have got with her also. मतलब लाइन में खड़े रहेंगे तो आपको राशन मिलेगा, राशन मिल गया तो काम हो गया. मतलब भगवान के दर्शन हो जाए, भगवान कुछ करे या नहीं हमारे लिए अलग बात है, दर्शन मिलना जरूरी है. So this is what we are all running after, just the kind of prescriptions, and the review of literature shows that there is very little evidence to support the use of all these therapies. And if you look at outcomes in the end, the outcomes are the same. The child is never able to go anywhere without a pattern or the structure or the rigid network that you have set the child in. If you change the structure a little slightly here and there, the child starts throwing tantrums or spinning around or shouting. You can't send him to a chachi's house, masi's house, unless you have told the chachi and masi what to do with the child all day. And this is the reality. And why is that? Because we are not finding the problem and we are not looking at the root causes. And hence, it's very important to use aspects of nurturing care to come up with a new perspective, which is looking beyond or beneath the symptoms, addressing the root cause and actually finding out what is the cause of these symptoms in us. I know many of you are highly foreign trained or trained here as well. And you know, okay, Dr. Dalwai, what are you talking? We send these children for diagnosis. And you may not have heard of DSM-5, that is the Diagnostic Statistical Manual of the American Academy of Psychiatry. And you've not heard of the ICD-10 perhaps, because we send the children to people who give us these diagnoses. Are you aware, my dear friend, that the DSM-5 is just a collection of symptoms? And it just tells you what score to give the child for a diagnosis, or the other way around. At what score of the symptoms do you give the child a diagnosis? So if the child does 6 out of 9, he has a diagnosis of hyperactivity. He does 6 out of 9, he has a diagnosis of attention deficit. He does 5 out of 9, he has no diagnosis. But the treatment for both these things is the same. Do the same therapy. It's like saying that if you have 103-degree fever and get chills 3 times a day, you have malaria. No blood test required, so smart. 303-degree fever and 3 times a day chills, malaria. 102-degree fever and twice a day chills, no malaria. But treatment is the same for both of you, paracetamol. Treat the fever. This is exactly how diagnoses are handed out. It's just like a screenshot and a label and a labeling of symptoms. But once you get a diagnosis, you have got the holy book. I have been certified, or this child has been certified. He is autistic. He can never get out of it. Autism never gets better. Why? Malaria never gets better if you keep treating the malaria with paracetamol. Typhoid doesn't get better if you keep treating the fever of typhoid with paracetamol. The fever will go down, come back again, unless you treat the malaria or the enteric fever or the typhoid. And hence, what's very important is, can we go beyond this westernized model of symptomatic intervention that they have brainwashed us into doing, and actually find out what is autism then? What is the cause of autism? And this across the last 21 years, these are data just from 2009 to 19. 2009, we started with Vrinda Datta madam, which we did a study with TIS together. And then after we learned, we continued doing our data, and she encouraged us to do that. So this is up to pre-COVID time, where we had 7,000 children. And you can see the number of children we were seeing every year, and the number of children who are diagnosed between 13, 14, 15, 16. Of course, now they've hit the roof, because we all know now that autism exists in 2.5 to 3% of the normal population. Crores and crores of people across the world, and crores in India. But when we looked at all these children, these thousands and thousands of children, for the first 15 years of my career, I was also offering them the same kind of intervention. You do this therapy, you do that therapy. But because it was a center, we could do some standardization, and we could keep the records. And over a period of time, I realized that the ultimate outcome is not related to the kind of intervention we give. So if one child we gave the same kind of intervention, the same number of sessions, the same good quality of sessions, one child could get very, very better, much better. The other child would not progress at all, would turn out like that other child we saw earlier. So when I look back and try to think, what can I find was the difference the first time I saw these two children? Could I have seen something at that time to guess that this child is going to do better with my standardized therapies? This child is not. What was the defining difference between these two children? And I realized something very, very interesting, which I am going to show you on the video here. These are, parents who have come to me with two children. On the left of the screen, you have a 6-year-old girl. She obviously has the problem, but there's a problem of autism. Why I'm showing you this video is because one of the worst or the most important reasons why autism doesn't get better, because we feel it is a speech problem. We feel it's a problem of speech, and speech has to be taught or treated. We don't understand that speech is a symptom. I'm here going to show you another 10-month-old child, little Johnny here, who's 10 months old. None of us would expect him to speak. She cannot, he cannot speak. Is there anything else that we can check to find out what is the difference between this so-called typically developing child and this so-called atypically developing autistic child? Watch carefully to how both these children pay attention to. So my first comment, a 10-month-old child is never happy to go to a stranger, because as you all know, he has stranger anxiety. So he doesn't like me a lot. But after some time, when I keep moving and behaving like a joker, making these funny faces, teasing him or tickling him or hugging him, cuddling him, see what changes between him and me. But also keep an eye out for who this girl or this child is engrossed with. And please don't take any pictures, because these are personal photographs of families. So please don't take any pictures. I really request you to do that.
Hi. Hello. How are you? How are you? बस ये प्यारे होके next time
Now you will see in some time, once I keep playing the fool with him, look at what's happening. Can you see what's happening? The child is paying attention to me. He doesn't know who I am. I am a human being. He's paying attention to a human being because another human being drew his attention to him. Look at this. Whom is she paying attention to? Whom is she engaged with? Now watch both these children. Even when I move away from the child, watch his engagement with me and keep a watch out for what this girl's engagement is.
Thank you. वाटर से भी पिला रहे हैं नहीं बॉटल पता है इसका पिला रहे थे पर इसमें बिल्कुल नहीं सिल्वर का एक चम्मच और But yeah, turn around.
I call this the Shah Rukh Khan sign for good reason. Look at his hands.
Bye. तो ये रिस्पॉन्स से हम जज कर सकते हैं नहीं वो समझ रहे हैं आप व्यक्ति है आपकी तरफ से आना है गिव अ रिटन हाय हेलो
Look at you, Johnny. He's still interested in this. Look at her.
How are you? Hi. Hello.
So you will see that the basic difference between the child who's going to develop normally, typically, and the child who hasn't. The basic problem is that this is the child who is focused more on objects and has not focused or paid attention to or connected or interacting or engaging meaningfully with other people. Postulated this theory that autism is a condition since birth where the child fails to connect, interact, or engage meaningfully with other human beings and is obsessed with objects. And in fact, we call this Ati Vastu Magnata or Kam Purush Magnata. This is the theory of human engagement and interaction that we have proposed and written about. Social behavior communication sequence, which we have done here. What we are trying to say is,
Dr. Dalwai, after you played the video, we are not getting you clear. Is the video stopped from your end? Maybe the video is causing some lack of clarity in your talk.
are you able to hear me better?
Yeah, now we are. Yeah.
Right. So after this basic cause of what goes wrong right at birth, what we came up with, is there a ladder? Is there a social milestones chart? Are there milestones that eventually lead the child up from this first stop or this first milestone, which is human engagement? If the child starts engaging with humans over a period of a few months, he keeps observing his mother that when the doorbell rings, the mother goes and opens the door. If the doorbell doesn't ring, the mother doesn't open the door. It's time for lunch, the mother puts the food on the table. After lunch, maybe the father picks up the plates and keeps them in the sink. So the child who is observing parents engaging with humans understand how humans behave. And this I explained last time is the difference between learning a skill versus learning human behaviors. Skill is what you do, how you do, whereas behavior is when do you do it and when do you not do it. Skill is opening the door clockwise or anti-clockwise, a lock. Behavior is knowing when to open the door, when not to open it. This happens in the first 5, 6, 7 months of life, and the child's brain then develops so much towards human behaviors. The neuroplasticity takes it so much towards humans that by 9, 10 months, the child starts understanding waving bye-bye, pointing, and gestures, which is non-verbal communication. And once these three milestones are perfected, then the brain becomes so evolved and so well connected in neuroplasticity that it starts understanding verbal communication, that is speech. And that's why it takes, for a good reason, a good year and a half before the child can understand speech and speak clearly. And a good 2 years of speaking your language, whatever you speak, understanding what others speak, are you ready to now learn another code, another way of communicating? This is in reading and writing, whether it is A, B, C, D, or A, I, E, or whatever it is. And this is the entire point that we are trying to show, that this is the normal developmental milestones like sitting, standing, walking, running, jumping. If the child does not sit, he will not develop muscles or a coordination good enough to stand. He will not be able to walk. Of course, he will not be able to run, and he will not be able to jump. So we have come up or proposed the New Horizons social behavior and communication sequence. And what we are proposing is that the only problem with the child with autism is not speech, is not behavior. It's basically poor human engagement. Hence, this child with poor human engagement does not know how to behave well, does not know how to communicate non-verbally, and that's why this child has a speech delay or a verbal delay. But another very interesting thing happens at the same time. When the first step goes wrong, instead of focusing on humans, little Johnny starts focusing on objects because objects are a million times more in this world than human beings. The child who's focusing on humans learns human behaviors and human communication. The child who's focusing on objects starts looking at objects and studying objects, and all objects are arranged in patterns. So this child becomes a pattern star, and that's why when he hears nursery rhymes or hears the mother saying, say mama, say mama, say mama, he can't understand speech because he hasn't got here. So he doesn't understand what that say mama means. But if he likes pattern of the sound say mama, he may repeat say mama. But that is only a copy or a meaningless repetition. So this is the rigid stereotypical behavior. He does the same thing everywhere purposely. And this is what causes the autism. And this is how autism symptoms develop. So does our theory explain all the symptoms? You will see here. What are the symptoms that arise due to failure of the new horizon social behavior communication sequence? If there is no social engagement with humans, the child will have poor eye contact as a symptom, will not respond to name call, poor human engagement, so he will not develop human behaviors, cannot understand what to do, where to sit down quietly, which auntie to be scared of and sit quietly, which uncle you can, throw your arms around. He doesn't know all that. He'll keep running around all the time searching for objects, and you will give him the symptom of hyperactivity. And that's why he will never understand speech, and that's why he will not speak, and you give it a symptom of speech delay. And this is where the symptoms come up. Similarly, pattern copying, if you keep saying good morning, good morning, good morning, say good morning, the child may repeat good morning, which is not normal speech. It is what we call echolalia, meaningless repetition of words and repetitive behaviors, like the child does not understand how to use a toy car, but will only keep spinning the wheels of the car, which is typical pattern copying behavior. And this is the neuroscience theory of human engagement and interaction of autism that leads to development of autism. So here is where I come back to the academicians. The theory of human engagement and interaction, we have shown the development of normal social behavior in a normally typically developing neurotypical child versus a neuroatypical child. The problem is not at the level of speech. The problem is at the interaction with humans. If the child's interaction with humans is normal, he will go on the normal sequence to become normal social behavior and communication. But if the child is deficient in interaction with humans and we don't do anything to correct it, it will have poor social behavior. The child will have impaired nonverbal communication. Will have excessive focus on objects, excessive pattern copying, and this leads to impaired social communication and behavior and restricted repetitive behaviors. That is what we are calling as the road to autism. And Vrinda madam, it's my pleasure that you are here to point out to you that the great academics that we follow tells us that DSM defines autism as a neurodevelopmental condition characterized by impaired social communication and interaction with restricted repetitive behaviors. The definition, ladies and gentlemen, tells us the symptoms or the result of the problem. The entire Western world has never understood that the real problem lies at the root cause, which is the interaction with humans. And this is what we have realized, and our research and work has been that this is just the definition of the characters, the symptoms. It is scoring the symptoms, but never tells you what to do to prevent these symptoms. And hence, you are end up with only focusing on the speech or the behaviors, never understanding that you have to work with this. So, is there another way? Can India show the way? My professors teach me, all of us, my seniors, that India is now where the whole world is looking. They're all looking at what happens in India is going to happen in the world soon. We are the people who have to show the way ahead. We did something at a very, very small level in our program at New Horizons called New Horizons Developmental Program. What did we do? When we started working with parents and children with this theory in mind, we realized that the biggest impediment was not the child, but the biggest point was to coach the parents to understand this concept. That do not focus on speech. Do not directly start working on the speech. Do not focus on whether your child is going to school and make him just sit in the corner in the school doing repetitive activities. You understand that the problem is far below, far beneath, far earlier. And do not focus on this, but focus on engaging with the child first. And this made us understand that the largest part of the work has to be done not inside, not on the child, because there is nothing largely wrong inside the child's body. But most problems are around the way. We are all teaching these children to say mama, say papa, ABCD, 1, 2, 3, 4, thereby worsening their patterns and completely ignoring sending them to the chachi, masi, bua, mami, and hence that is worsening the symptoms of autism. So the largest part of our program is on parent coaching monthly by the developmental pediatrician, and whatever is a program set up by the developmental pediatrician is spoken of in more detail by our counselors in a weekly session, and that we believe is 70% of the impact on the child. Of course, we may have some sessions for the child, but that is only 25%. Medications don't help more than 5%. So it is parent coaching that is the way ahead. And going ahead, what we have realized that this is a new model of intervention which focuses on the theory of human engagement and interaction and the social behavioral communication sequence rather than directly jumping at speech and reading and writing. And hence, we have shown a paradigm shift from the symptom or therapy based approach to targeted sequence oriented interventions. And hence, coaching parents is more important than these repetitive year after year therapies for children. And lo and behold, if it is coaching parents that is more important, this can even be delivered online. That's what we call the LHDP or the New Levels Development Program. What do we do in the program? Lots and lots and lots of things. But one simple striking thing is we make the parent understand don't focus on the verbal communication because that is like making a child walk when the child can't even sit. First, focus on making the child sit. In other words, in this case, make the child engage with humans and then work up the sequence eventually to reach the stage where the child can pick up speech on his or her own without becoming echolating. And now we are able to deliver this even on an online platform because there is more to do with parents coaching and getting them to understand how to treat a child normally at home on this sequence rather than just giving him too many therapies. And the most important thing is what goals do we set? Can you just mute everybody?
ROAR.
Ruby, can you
What
remove the person? Because there is some
what
disturbance also.
what goals do we set? If we set shape sorting, repeating ABCD, repeating good morning, names of vegetables, pointing to an object and saying papa, or pointing to an object and saying carrot, that is not a goal of improvement, my friends. That is a pattern learning goal. And as we realize at New Horizons, pattern learning is actually the problem that the child has. Are we, in our innocence, worsening the child's pattern learning and taking it as improvement? So we stopped doing that because we were doing it for the first 15 years. Last 6, 8 years, we have directed our goals towards achieving social behavior and communication milestones with respect to family, then relatives, then older adults, then older children, and lastly peers. So if the child learns the right human engagement and behavior and communication with the family, then he can gravitate or graduate to the relatives. Then he can adapt a little more to older adults, then a little more to older children. And with all this armament here, does he or she have the strength to adapt to the peers? What is the commonest suggestion given to parents who tell you my child is not speaking or behaving normally? उसको स्कूल में डालो, प्ले स्कूल में डालो, वो सब सीखेगा. So you are saying that my child can't swim in the swimming pool, in the baby swimming pool. Oh, your solution is throw him into the Indian Ocean because there is much more water in the Indian Ocean. The swimming pool has little water. घर पे कोई बच्चा नहीं है ना तुम्हारे, इसलिए उसको बातचीत नहीं आता है. उसको स्कूल में डालो. मतलब घर में स्विमिंग पूल में कितना ही पानी होगा, उसको समुद्र में डाल दो, बहुत पानी है, उधर बहुत तैरने सीखेगा. This is the logic. And the child is more likely to drown than otherwise. But if you go in this sequence of family, relatives, older adults, and older children, all our children develop the capacity for school in a much better way because they are now ready to deal with different older individuals, such as teachers, helpers, and friends, and also their peers. So we coach the family on an algorithm and they handle the child to coach the child to follow goals in a step-by-step manner. So our program, step one, is seen by the developmental pediatrician. Every child is seen who plans the overall goals for the child in the overall development, not only focusing on one development, one domain like speech or reading and writing. Now those goals are taken to the team of developmental specialists, paraprofessionals who work with the child or coach the parents weekly basis. Based on that, at the end of the month, again the development pediatrician follows up and monitors the progress of the child. And based on that, every 3 months we make these reports to see whether the child is progressing the way we want, at the speed we want, or have we just sent him typically what is happening otherwise. You go and do this therapy till kingdom comes. Keep doing it till you run out of money or till you feel it's no longer important. No, you can't just consign them to imprisonment like that. You have to monitor the progress, and that's what we do. And that's why I would like to show the pictures of these wonderful 5 people who I worked with, who are the developmental pediatricians. But in addition to them, there is a whole lot of developmental therapists, specialists, speech therapists, psychologists, special educators. But the point is, they all follow a plan. The key issue is everybody in the center follows a plan. People don't start doing whatever they want whenever they see the child. However senior we may be, however expert we may be, I can't do what I want with the child. I have to follow the plan made by the team. And this is the basic difference between what we do and what's happening anywhere else. So, what is the evidence? Have our children actually got better? Again, a very humble hand folded request to you, please don't take photographs. You can hear and see this, but don't take photographs. What I'm going to show you is a parent who's going to talk about what are the child's improvements. And this is an online parent from Aurangabad who has been taking online therapy. Our usual goals in 6, 8, 1 months, 1 year of intervention is okay, is a child sitting quietly in the classroom? Is he repeating nursery rhymes? Does he respond when you say, what is your name? My name is Samir. It's okay if you say, tell me your name, you won't say Samir. But does he say, what is your name? Samir bolta hai na. Okay, does he do shape sorting? He's sitting quietly in the corner with the shadow teacher? No. Oh, very good, very good. That's all. Don't worry about anything. Our goals are not like that. I know that might sound a little bit like a mocking, but let's look at what our goals are.
Today we took him to a fair. The mela was such huge that even we couldn't walk in. Like, he did not show discomfort. He was comfortable. He acted.
I'm saying this because, oh, we can't take our child to a crowded place because he starts screaming and shouting and stimming. So our team has told us, don't take him in a crowded place because then he will throw tantrums. Look at what this mother is saying.
He enjoyed the rides, sitting in the chota aeroplane, the chota car, jo go to like in a fair, mall में ठीक है, mall में he was comfortable, but in a fair जहाँ इतने लोग खड़े रहने की जगह नहीं है, he didn't show a single percent discomfort. बस जाते टाइम उसने balloon के लिए जिद की.
There you will say, Dr. Dalwai, you have failed. Now see, this child is object obsessed. He still wants a balloon, but listen why he wants the balloon.
और हमने उसको दिला दिया कि fine, take it. And after come, while coming home in the car, he was like, दादी को दिखाएंगे, दादा को दिखाएंगे.
How sweet.
That was something that I was waiting.
So even if this child has some interest in an object, it is with respect to a human being. He wants to give that object to a human being, the dada or the dada.
Today we took him.
Again.
ऋषि ठीक है, मतलब ऐसे हमें कोई चैलेंजेस नहीं है अभी, जैसे पहले था. अब तो हम लोग क्राउडेड एरियाज में भी लेके जाते हैं. यहाँ पे हम लोग अभी रिसेंटली शिफ्ट हो गए हैं न्यू प्लेस पे, सोसाइटी में शिफ्ट हुए हैं अभी 20 डेज पहले. बिल्कुल उसके अंदर एक्साइटमेंट है क्योंकि उसे अभी बहुत सारे लोग हैं और उसके लिए अभी पार्टिसिपेशंस, जैसे क्रिसमस था तो उसमें कॉम्पिटिशन्स हो रहे थे, डिनर था. तो तब में वहां पे वो गई, उसने बहुत सारे लोगों को, मतलब सब लोग बैठ के डिनर कर रहे थे, टेबल्स थी, चेयर्स थे और काफी लोग बैठे थे, मतलब 100 के अराउंड लोग बैठ के डिनर कर रहे थे. तो उसको एक्साइटमेंट था, लेकिन उसकी ऐसा नहीं था कि वो इधर उधर रन कर रही है या उसका ऑब्जर्वेशन नहीं है. ये सब ट्रीटमेंट ऋषि ठीक है. वहां पे वो गई, उसने बहुत सारे लोगों को, मतलब सब लोग बैठ के डिनर कर रहे थे, टेबल्स थी, चेयर्स थे और काफी लोग बैठे थे, मतलब 100 के.
The most important thing is visiting relatives and knowing how to behave in these events.
So it actually worked. Your program is definitely working for us. Yeah, as far as the non-verbal communication goes, that is the second thing that I would say. It has just worked so well. Something, and my daughter said like this. That was something new for me. She showed a thumbs up. And I was like, wow. So these are some changes that is happening. And I think that's great. And even the eye contact has improved a lot. Then her smile, giving smile or reacting. Like sometimes girls do that, like if she's feeling shy or something, then you just sit down and smile. She did that in quite many number of times, which was just absent before. So I'm enjoying all the non-verbal cues. So it actually
So you see, if you set the goals right and you understand what to work on and you work according to a particular method, in our experience, especially post-COVID, 90% of our children in the first 3 months have shown an improvement in sleep schedule, constipation, and reduced screen time interaction and better social behavior. Whereas 80% of our children show improvement in the human engagement and social behaviors per se in the first 3 months. But the online is even more interesting. Now we have more than 500 children who have received treatment online. And as we can see, 80% have shown improvement in social interaction and social behavior. And now we've been able to reach children not just in India but across the world. Now, this is a medical journal which I'm sure many of you may have seen earlier. One of the most impactful journals in India, impact factor of 4, Indian Journal of Pediatrics. And this is an article or a letter which has been published from us, a clinical case study. We all think that children with autism have a problem with hair cutting, with bathing, and with eating, and with dressing, undressing. They have particular likes, dislikes about hair cutting. These are two children from out of Bombay. One is from Dubai. We haven't even seen these children. They were only given an online intervention. The parents were coached first to develop good human engagement. They were then taught about human behaviors at home. And then so the way we managed to coach these parents, both these children who used to hate and create a ruckus going for a haircut are now going and enjoying their entire experience there. And this was published in the scientific letter in January 2024 in the Indian Journal of Pediatrics. It's available online. Please, you can go ahead and look it up. Or if anybody writes to me, I can send you this article. Generally, before we started this method, we used to receive feedback from pediatricians across our 5 centers. The doctor, there is a frequent change in therapists. The doctors keep changing, the therapists keep changing, etc., etc. This now doesn't matter to us because we now work on a system-based algorithm where the development pediatricians, according to the systems and the goals, and the plan is made by the senior team members again according to a system. And our team implements the plan with the child and parent. Everybody doesn't try to do whatever they feel is in the best interest of the child. Everybody's intention is good, but it doesn't help if too many cooks spoil the soup. So you have to do what a plan says. And that's why the plan of the program remains constant, irrespective of the change in the person who's delivering it, whether Dr. Dalwai is alive or dead, the program will continue in the same way for the child. Now, finally, can this be scaled? It's all very good, doctor, you're doing it in your clinic. What about the rest of us? See, the rest of us or the rest of the country, what are the challenges actually? Why they can't be scaled? The current interventions. Because nobody gives you an update on the child's progress once the child has been referred to a particular specialist. There may be other complications. The child may be having epilepsy or seizures or any other mental physical problems which may not be picked up because each specialist is focused only on one area. And if this is symptomatic management, nobody is looking at the root cause. And that's why you need highly skilled professionals who know how to get by all of this, who are very, very rare. But in New Horizons Developmental Program, there is a solution for everything. First is we work on the root cause. We are outcome oriented and time bound. Every month, the development pediatrician is monitoring the improvement in the child. And the system driven independent of specific doctors. Even if you have to do some physical sessions, they are far, far less than what we were ourselves doing 4 or 5 years back. And the largely important part is a weekly parental education required for the child's day-to-day functional activities and monthly progress monitoring by the development pediatrician. And of course, it works more cost effective, not just in what you actually pay at that time, but if something is going to get solved in 8, 9, 10 months, 12 months, and you continue to otherwise pay for it for 4 years, 5 years, by itself it is cost effective, obviously. And more importantly, the outcome is entirely different. Rather than a robot or a parrot who keeps repeating what has been pattern trained, you have a child, like you heard those three mothers, who behaves normally in society. And this is what has happened in the last 4 years, 3 years post-COVID, that not just India, but we have children coming to us online from various countries across the world, 10 to 12 countries. So finally, the way ahead is what I'd like to tell all of us is that India has, 40, 50 crore children. If you look at 2.5 to 3% of children who have autism, then imagine, is it ever going to be possible for developmental pediatricians to reach all of them? It's not going to be possible for even general pediatricians to reach all of them. But who reaches every child? The school reaches every child. Most children, I'm saying, in India do go to a school. So if the schools understand what this mechanism is, and if the schools are able to collaborate and take up this method and apply this method, sure enough, the most severe ones may still need to go to a hospital or a therapy center or whatever. But any illness or any problem, the larger majority is a mild or the moderate variety. 75 to 80% of children with autism have a milder or a moderate variety. They can all function far, far, far better with this. Maybe 10-20% are really severe. They have seizures, they have other problems. They definitely need to be seen by a neurosurgeon or a neurologist or a developmental pediatrician or a center. But the most number of children can be done by this. The trouble is either we shun them out of school, we don't admit them in our school, or we say you will have to do therapies in the school, which are again symptomatic. And let's accept it. Schools are the temples of learning. They are not the experts in developmental disorders. Maybe expert in history, geography, preschool education, early childhood development. Let's accept it. I'm not an expert in mathematics, or I can't be a mathematics teacher, or I cannot be a language teacher, or even an early school teacher. I cannot be. Similarly, let's not assume everybody can be a developmental pediatrician, come occupational therapist, come speech therapist, come counselor, come psychologist, all wrapped in one. And don't harbor that fake assumption कि नहीं हमारे इधर हम 200 रुपए ही लेता है बच्चे का एक सेशन के लिए, बेचारा किधर किधर जाएगा। अरे आप 200 रुपया लो या 2000 रुपया लो, गलत काम गलत है। 200 रुपया लेके गलत काम करना कोई भले की बात नहीं है। The point is we keep subjecting to them all these therapies which go on year and year, और नहीं करेगा तो स्कूल से निकाल देंगे। But in spite of doing this, the child comes to the class, keeps running around everywhere. So now there is a new invention, shadow teacher. There are schools in many parts of the country which insist that the child gets evaluation done from a particular center for a particular reason, of course. Then insist that they do therapies at a particular center or in their school, again for a particular purpose. And after that, they charge 18 to 24,000 for a shadow teacher, out of which again we know who benefits most from it, the child or the school. But the child certainly does not benefit, because one day if the shadow teacher has a viral infection and absent, this child is sent back from the door of the school. What kind of inclusion are you talking about? What inclusion? This is the worst form of racism and the worst form of exploitation. But the irony is, we genuinely think we are doing a good thing. This is the problem. If we knew that these people were villains, we could castigate them. But these people also think they are doing something. अरे बेचारा ऑटिस्टिक का बच्चा, वो जिंदगी भर ऐसा ही रहने वाला है, मैं कम से कम उसको स्कूल में लिया, उसका माँ बाप को जरा राहत मिला कि मेरा बच्चा स्कूल जा रहा है। वो कॉर्नर में बैठ के शैडो टीचर पकड़ रही है उसको, वो भाग रहा है, शैडो टीचर पीछे भाग रही है, लेकिन हमारे दूसरे बच्चों को तो डिस्टर्ब नहीं कर रहा है। कम से कम पेरेंट्स का इज्जत रहा है सोसाइटी में कि उनका बच्चा भी स्कूल जा रहा है और ये मैं महान कार्य कर रहा हूँ बच्चे के लिए। प्लीज लेट्स गेट रिड ऑफ ऑल दिस when there is a better way. And the better way is when we understand that these are situations that have to be looked at. And I'm not saying I'm the only one who's got a brilliant solution. My point is, nobody wants to find a solution. Everybody is happy doing the symptomatic therapies क्योंकि सबको win-win factor है इसमें, except the child and the family. There is no win-win for the child or the family. The family is fooled to think तुम्हारा बच्चा स्कूल जा रहा है, तो कॉर्नर में बैठ के शैडो टीचर पकड़ के बैठा है उसको, लेकिन you are exploiting somebody's feelings. That's not the right thing to do. The irony is you are not thinking that you are doing anything wrong. This is what we have to teach each other, because this is what needs to change. This thought that autism cannot get better. We cannot make autism better. Abhi, many people will get up and start shouting, oh, autism can't get better. Why are you giving people false hope? I am saying, why are you not taking more effort to find out what can make it better? I have nothing against giving these therapies or these programs or whatever. I am against all of us joining hands on World Autism Day, wearing blue color clothes, like whatever, and joining hands and shouting, "This is an enigma, this is a mystery, accept it." But keep spending 2.5 lakh rupees per year to do these therapies. But your child will not become normal. You go to a doctor or a therapist, what caused this? I don't know. This is an enigma. Nobody in the world knows. It's an enigma to me. When will it get better? I don't know. That's also an enigma to me. What will make it better? For sure, I don't know. How much time will it take? Arey, it's a mystery. Bola na baba. I don't know when it will get better. But you keep doing these therapies. How many times? 6 times a week? I can't come 6 times, doctor. 5 times a week आ जाओ. I can't come 5 times. Doctor, 2 बार चलेगा? हाँ, 2 बार चलेगा. डॉक्टर अभी आज मेरे घर पे कोई आए, 1 बार चलेगा? हाँ, 1 बार चलेगा. कौन सा ट्रीटमेंट है दुनिया में जो ऐसा चलता है? डॉक्टर मेरे कैंसर है, पूरा गांठ मत निकालो, छोटा सा गांठ निकालो. अच्छा ठीक है, उसका इतना रुपया है. नहीं डॉक्टर, और थोड़ा कम गांठ निकालेगा तो और कम पैसा में नहीं कर सकते आप? हाँ कर सकते हैं, थोड़ा सा ही पार्ट निकालेगा ऑटिज्म. लेकिन डॉक्टर कैंसर, इतना बजट नहीं हमारा ना, इतना बार नहीं आ सकते, थोड़ा और छोटा सा निकालो, कम पैसा दे दो. Is this the way we even think? This is the way which you are doing this. So it's a big wake-up call. Don't say that autism is an enigma. Which, if I say autism is an enigma, to me, I'm basically saying I'm an idiot. That after 21 years in this field, I still don't know what I'm charging patients for. And I'm claiming I've given therapy to 20,000 patients when it is an enigma to me. I should be ashamed of myself. Anybody who says that we cannot find out the cause of autism should be ashamed of themselves. I'm not saying they should find out the cause. I'm saying stop giving up the responsibility of finding a cause. मुझे नहीं ढूंढना है, अमेरिका ढूंढेगा. Then America says organophosphorus poisoning causes autism. Everybody stops organophosphorus. Then it says vaccine causes, everybody stops vaccines. Then a few years say नहीं वैक्सीन से कुछ नहीं होता है, वैक्सीन लगाओ, organophosphorus poisoning वापस से. अभी now something else, television towers, रेडियो टावर्स और समथिंग सैटेलाइट टावर्स. नाउ सैटेलाइट से बचाओ, उसके लिए क्या है, वो घर पे कुछ यंत्र लगाओ, उससे सैटेलाइट का अंदर रेज नहीं आएगा, ऑटिज्म बचेगा. कुछ साल के बाद बोलेंगे दे सेड एबीए हैज एविडेंस बेस्ड थेरेपी. नाउ दे आर ऑल सेइंग देयर इज नो एविडेंस. अरे तो व्हाट हैपेंड टू दैट एविडेंस 2 years बैक? कोई खा गया क्या वो एविडेंस को? अब किधर गया वो एविडेंस? नहीं, थिंग्स इवॉल्व. तो तभी क्यों डंके के चोट पे कह रहे थे कि दिस इज द ट्रीटमेंट, when even at that time you said that any autism is an enigma, but ABA is a better treatment for it. All rubbish. You're doing Pavlovian experiments with children. So basically going ahead, the idea is that each of us should stand up and say, no, I will find the root cause. Let me do some research. Let me find out what is the cause and how these children can get better. So going ahead, like I said, this has been our experience in the Enable program. And this is how the Enable program works again. Monthly consultation with the doctor first, who defines the child's program, intervention planning by all of us, then the planned engagement online with the parents and child, again the monthly follow-up with the doctor, quarterly progress to see that the child is going on the right track or no. And these are the way we work. It's measurable, monthly tracking, quarterly tracking. It's not easy. I'm not claiming it's easy at all. It's a 24/7 job that we have to do. But if you define some basic principles of management, like keep it outcome oriented, make specific goals, track those goals. If things are not going right, red flag it. Immediately the development pediatrician has to step in and track it weekly and see whether it's happening. And 3 months, some time limit you have to put at the start of the program. So basically there is documentation, because every time the development pediatrician sees the child, he has to document what he saw. I see so many children who come to me for the first time for a second opinion. 2 साल से therapy कर रहे हैं. क्या therapy में क्या? Not a scrap of paper. Not a scrap of paper, what the professional did for 2 years for a child, saying that it's a serious problem, taking money every time, but not written down what has been done. How can you do that? Clinical meetings is what we keep doing regularly inside the center, discussing each and every child's plan and progress. And finally, most important is monitoring the review and parental feedback of every child. So that's the way we've organized our program. So there's like a closed loop all the time. So step one, the doctor or the school gives the contact details to the patient or the child calls the online team. The online team books a consultation with the developmental pediatrician, and the developmental pediatrician starts the 3 months program where every week the consultation is done with the details with the coach who coaches the child, the coaches the family based on what the development pediatrician has said, and so on and so forth that goes on. And these are some of the details. Of course, we have 6 centers in Mumbai, but like I said, what is very, very more interesting is to reach out across the country, across the world, wherever with the online thing. But any of you who have children who you do think need a better approach than what's happening now, or you need a solution or a much better normalization, you're more than welcome to connect to each of us. So the take-home message is understand the difference between symptomatic therapies and targeting the root cause. In autism, the root cause is more likely to be poor human engagement and increased object engagement, which is a New Horizons theory of human engagement and interaction that I spoke to you about. Follow the New Horizons social behavior communication sequence yourselves as teachers, as academicians for assessing and monitoring the child and guiding the parents and family. And most important, this is my request to all of you, with the schools collaborating on such an online program like the Enable Parent Coaching Program, it is possible to help every child and every family wherever you may be in India. So this is what I wanted to end, because all my last 20 years, at least the last 12, 13 years, I've been traveling almost every weekend. And Purnima madam is always, Arey Samir, my phone, kahan hai tu abhi? So it's either Kanpur or tomorrow I'm going to Bhubaneswar. Last week I was at Hingoli. The week before that I was at some other place. And everywhere I go and I give these talks on autism, and I have trained pediatricians. So they say, अरे डॉक्टर लेक्चर तो सब ठीक है तुम्हारा, तुम तो मुंबई में है, तुम्हारे पास इतने बड़े बड़े सेंटर्स हैं, इतने डॉक्टर्स हैं, थेरेपिस्ट है, हमारे इधर तो थेरेपिस्ट भी नहीं मिलता है. So to give them hope and strength, I came up with this story where Amitabh Bachchan says, आज मेरे पास बिल्डिंगें हैं, प्रॉपर्टी है, बैंक बैलेंस है, बंगला है, गाड़ी है, क्या है तुम्हारे पास? So Shashi Kapoor says, मेरे पास माँ है. So I told the pediatricians that if Samir Dalwai comes to you and tells you, मेरे पास 6 centers है, online division है, OT है, speech therapist है, developmental pediatricians है, मैं खुद development pediatricians हूँ, psychologist है, क्या है तुम्हारे पास? You should not worry. You should say, मेरे पास बच्चे की माँ है. Because if you train the child's mother and you guide the mother correctly, the child will do better. So this Shashi Kapoor today is not just the pediatrician, it's all you school teachers and school educationists and the trustees and academicians, all of you who work with children, you have this. You don't need to get cowed down by a bullying Amitabh Bachchan. You can be the humble Shashi Kapoor who's on the path of righteousness and say, मेरे पास माँ है. Thank you so much. These are some of the details. If any of you would like to reach out, you can take a screenshot or a snapshot, or I can put the details here. But again, thanks a lot. And I really enjoyed myself. I hope the experience is mutual. Thank you very much.
Absolutely, Dr. Dalwai. You not only told us and explained to us a very complex topic in a simple way, you also kept us engaged by your real, your passion and your actual work, which you have done. And you also ended it on a note which most of us are very familiar with. And how nice of you to think of that line, कि मेरे पास बच्चे की माँ है. I mean, I think that was really a wonderful paraphrasing that you did. We have many questions online, but I'll just begin by asking one of my own as the prerogative of the anchor. And I just wanted to understand that fantastic video which you showed us where you are interacting with the child, and the child is the younger sibling, and the older sibling is interacting with the teddy bear or whatever it is. And the child is, that older child is in a way responding. She's noting your actions and she's doing that with the teddy bear. So what is it that we should understand from that child's action? From the autistic child's action? What is the learning from there?
I didn't intend to show or mean it sound that she's looking at me and doing it with the child. That is the problem. She's not looking at me.
Okay.
She's interested only in the object. If I take the object away, then she'll look at me. Or if she can't reach an object, then she'll catch the mother's hand, drag her, take that object, और जैसे ही object मिल गया, माँ को बेदखल कर दिया, focus object पे.
Okay.
So if I can take the liberty to speak in Hindi, it's for the simple reason that maybe we are able to express ourselves better.
Yeah.
So there's a word in Hindi or Urdu or whatever Hindustani you call it, called tawajjo.
Yeah.
Tawajjo does not mean only looking. Tawajjo means giving importance and looking.
Yeah.
या ध्यान देना, ध्यान देना, लक्ष देणं, लक्ष देणे. एका गोष्टीत माझा जीव अटकलाय, मराठीत we say like that, कि मेरी जान किसी में अटकी हुई है. ये सब चीजें हैं, ये बच्चा चीजों के तरफ करता है, ये बातें. लेकिन जो टिपिकली डेवलपिंग बच्चा है मेरे थियरी के हिसाब से, उसकी जान इंसानों में अटकी है, उसकी तवज्जो इंसानों में है, उसका लक्ष्य, उसका ध्यान इंसानों की तरफ है। इसीलिए मैं इसको कहता हूं अति वस्तु मगनता, मगन होना, अति एक्सेस, अति वस्तु मगनता और कम मनुष्य मगनता। और इसमें मैं एक बात खारिज करना चाहता हूं, जो हम कहते हैं कि ये बच्चा स्वमग्न है, आत्ममग्न है, ये सबसे बड़ा बकवास है। और ये किस आदमी ने इसका तर्जुमा या ट्रांसलेशन किया मुझे पता नहीं, क्योंकि ऑटिज्म का मतलब है इट केम फ्रॉम विद इन द चाइल्ड। लियो कैनर का पेपर, ऑल ऑफ यू आर academicians, 1943 he wrote this paper, affective disorders of the child. When he described that these children were autistic, he meant to say, read the paper, I mean I could have shown that paper. I am calling it autism. Autos means self. Autism, selfism. What he meant is that the disorder is coming from within the self. It is not like a malaria which comes from outside or a typhoid which comes from outside. And Kanner was saying this because he was differentiating it from schizophrenia or so-called childhood schizophrenia. And the reason he described it was to say that childhood schizophrenia, at least there was a period of 2 year normalcy sometime in life, that the person was normal at least for 2 years and then he developed symptoms. That can be schizophrenia. But if there were always symptoms of autism from the beginning of life, from within life, then it is autism. It is not schizophrenia. So this is where he described autism. Some idiot translated autism as if self-involved. These children are self-involved. They are swamagna. They are not self-involved. They are object-involved. This is my theory. They are object-involved.
And
from
our effort,
objects, they learn patterns. Yeah.
yeah, and your therapy is to get them to be involved into the people. Your therapy,
Absolutely.
yeah, yeah.
Is our therapy, the principle is reversal of this vastu magnata, manush magnata. Cut out the objects, stop the vastu. So the child has a trait of asti vastu magnata. But आप क्या कर रहे हो? 3 साल के बच्चे को मोबाइल दे रहे हो, टीवी दे रहे हो, टॉयज ला के दे रहे हो, ब्लॉक्स ला के दे रहे हो, तो दे रहे हो, लेकिन आप हो ही नहीं सामने, क्योंकि आप भी आपके मोबाइल पे बैठे हो। आपके घर में कोई है ही नहीं, दादा दादी तो है ही नहीं, चाचा चाची मामी फूफी मुमानी तो सवाल ही नहीं आता है। तो हमने ये ट्रेट जो है ऑटिज्म का, ये नया कोविड जैसा नया डिसऑर्डर नहीं है। दिस हैज बीन देयर थाउजेंड्स ऑफ इयर्स, बट इवन 2 generations और 1 generation बैक व्हेन वी ग्रो अप, घर में ऑब्जेक्ट्स थे ही कितने? 10 लोग मिलके एक बैट होती थी या एक बॉल होता था, या लेडीज कैन से व्हाटएवर दे वर डूइंग, लेकिन लोग कितने थे? तो ये ट्रेट जिसको था, उसको समाज से मनुष्य मग्नता मिलती थी डे वन ऑफ लाइफ से। एक तो पैदा होता था बच्चा ननियाल में या मायके में, तो उधर नानी है, नाना है, मामू है, मामा है, मामी है, मासी है, तो पहले दिन से आके सभी क्यों 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 क्यों। सो चाइल्ड के अंदर डेफिशिएंसी है, लेकिन बाहर से दे रहे, जैसे विटामिन डी कम है तो आप विटामिन डी पिला रहे हो, तो बच्चे में ह्यूमन एंगेजमेंट कम है, लेकिन मासी चाची मामी दिन भर को छोड़ ही नहीं रहे कोई बच्चे को। डे वन से थेरेपी मिल रही थी और ऑब्जेक्ट्स थे ही नहीं, इसलिए ये जीन के लोग ऑटिस्टिक फ्रैंकली नहीं हुए। They were the absent-minded professors.
Yeah.
They still were those introverts. They were not very good at socializing, but they were brilliant at physics. They were brilliant at chemistry, at maths, at economics, at music, at literature, at painting. Why? Because maths, music, physics, chemistry, economics, literature are all pattern-based. 1 + 1 is 2. Newton's law is Newton's law. So these guys were already then pattern oriented and less human oriented, but society environment around them prevented them from becoming too pattern oriented and made them human oriented. When this changed in the last 10-15 years, especially when society families became smaller, but more than that, when this object came in, I don't know whether you can see this,
The mobile.
the mobile, because that is one object where you don't need any other object. That is one object where you don't need any other object with this object. So the child is fully focused on this object and has no time to look at parents. Now, yesterday, I've done some 10 sessions in this week, and fortunately, this is my last in Autism Week. Somebody said, does it mean, Dr. Dalwai, that joint families में autism कम होता है, nuclear families में ज़्यादा होता है? अरे joint family है, मासी मामी भी है, चाचा चाची भी है, अरे लेकिन चाचा चाची भी तो ऐसे ही बैठे हैं, बच्चे को कौन देख रहा है?
So Dr. Dalwai,
So-
my next thought is that there are teachers in the group and there would also be parents. So is it that, you would be, how can teachers learn to manage the child in their school? And how can parents learn it in their, in context of their own child? Is there some training you offer, or what are the courses that people can do, or how can teachers become equipped to handle? What are the options that are available with you? What can we look out for?
The first thing is you can refer this child for this program with our team, because the child and the family, rather the parents, have to be handheld to understand how to go through this. At every step, what to do and more importantly, what not to do is very important. So in the first level where the child is, we may tell the child, parents to do certain things and not do certain things. But as the child gets better, we have to change the advice. It's not giving the same therapies for years on end. As the child progresses, the program has to change. And that's why every month it is necessary that the developmental pediatrician see you. That's part of the program. So they keep coaching the parents. Just give me 1 second. I'm very sorry.
I think Dr. Dalwai is taking a pause. So just for 2 minutes, we have a pause. If there's something that,
Yeah. No, sorry, there's an urgent call. So basically, this is how we handhold the parents to go through this. So that's the easy part.
So the idea is
Now
whether it's
coming
a
to,
parent
yeah.
or a teacher, they should get in touch with you, with the centers which you sort of told us,
Yes,
for them to plan whatever it is that they want to do with the child further.
yes,
The
yes,
first step is to contact you, and then you would guide them
yes,
in a particular way, right?
yes.
Yeah. Okay. Yeah. Sorry, doctor, you were saying. Please kindly.
No, that's it. Go ahead. You're
Yeah.
right.
So there are a few questions. One person wants to know that is autism a genetic disorder, and can it be identified by any test during pregnancy?
Good question. And I'll
And
answer
how,
that.
and can it be prevented?
Okay. Meanwhile, I've just shared some messages in the group so you can look at them. Now,
Yeah.
autism is a genetic cause. Let me tell you, my big nose is basically a genetic problem, or it's been caused by my color of my eyes is genetic. Everything that happens in our life is determined by our genes, but not only by the genes. The genes and the environment has to interact. Let me give you an example. We know that people smoke. Some of them who smoke get cancer. Some smoke like a chimney and they don't seem to have any problem at all.
Yeah.
If 10 people smoke, 5 get cancer, 5 don't get cancer at all. Because the 5 who have a gene for cancer, they get affected by the smoking and they develop cancer. Whereas those who don't have the genes will not. There are some people who eat कुछ नहीं खाते बेचारे, but they are like, sometimes we see that they are rather over the top in weight. And there are some people who eat throughout the day and they never get diabetes, nothing. We call them the lucky people. It's genes. Similarly, there is a gene that causes autism. My research or my work or contribution towards it is identifying what part of the environment triggers that gene.
Yeah.
And what we have realized is what is the gene for and what triggers that gene. So if there is a gene for cancer, then the cigarette smoking triggers that cancer gene. I have believed, or my team believes, we have worked on saying that there is a gene which makes the child have a trait of being object involved and less human involved. This is the trait of that gene. So somebody who has that gene has a trait towards object involvement and away from humans. Now, if this child starts getting too many objects from childhood, mobile phone from 3 months of age to learn nursery rhymes, and is being fed objects and patterns all his life, and at the same time humans have moved away, he doesn't have many people to engage or interact with, then that will trigger off that sequence like I described. And that is the normal sequence. And because the first step doesn't happen, the behavior, the non-verbal or the verbal doesn't happen. So yes, it is genetic. Now your next part of your question, is there a way of detecting it in the
Pregnancy.
The trouble is the whole Western world doesn't know, or they believe symptoms are autism, because according to the DSM-5 is a list of symptoms 4 out of 5. So they look for genes for everything, for speech also, for behavior also, for hyperactivity also, for repetition also, everything. With the result that they have found 2000 genes, not one of them is specific for it. So 2000 genes hai, but none of them are specific. There may be so many people who have that gene and don't have autism. There may be many who have autism and don't have that gene, except Fragile X. So there is a genetic disorder called Fragile X, and it is known that most children with Fragile X may have some autistic features. But out of 100 children with autism, only one will be because of Fragile X. So yes, if there is a child who has mental subnormality, intellectual disability, autistic features, delayed development, and there is history in the mother's family of Masi also having a similar child, because this is X-linked.
Yes.
In that case, if the mother has Fragile X, or if one child has Fragile X, then you should test if the child has Fragile X, you should test all the Masis in the family for Fragile X, and the mamas also, the mother's side basically. Because the child gets is the male child, Fragile X is obviously in boys most common. So X and Y chromosomes. So the Y obviously comes from the father, the X comes from the mother. So if there is a problem with the X which is fragile, it has come from the mother's side. So if there is a history of bad obstetric history on the mother's side, or some children who are born delayed, slow, intellectually disabled, or autism, then you should test the mother for Fragile X for sure. Then there are some very rare disorders like Angelman and etc., which won't merit causing a scare here because they are 1 in a million. But besides that, there is no definite gene that has been identified yet, which can tell you in the pregnant mother that this child is going to be autistic.
So unless there is a history, family history, there is no point in all the pregnant mothers going in for a test to detect if their child could be autistic. I mean, there is no such thing.
Yes.
Yeah.
Just to be more responsible, I would say that the
Yeah.
best part is ask your pediatrician or your gynecologist. Discuss with them. Don't fall for these advertisements. Oh, we do stem cell banking or this cord banking and all. I'm just saying be a little careful about this. Consult your doctor, get a written opinion. If your written opinion doctor is saying that he's kind of putting his name on the line, right? Then you can definitely listen to that, because when I write something on paper, I'm medico-legally responsible for it. So generally, nobody will write something unless they are very sure about it. At least they have a genuine intention. Go for that.
There is a question, doctor, that can you throw some light on the Gestalt learning and Hanen approach for children with autism spectrum disorder?
I do not believe in that method at all. Hence, I cannot shed any light on it. But I can say enough to know that I don't believe it works. It may only end up making the child echolalic or patterned or to a limited extent. But what I will say is that, does speech come after birth immediately? No. There is a sequence. Does running come automatically? No. There is a sequence. Sitting, standing, walking, running. My point is, let's stop being obsessed with speech and education. This is the real reason why we have not been finding a cure, because everybody is finding a cure for the symptom of speech. And there is no cure, because you cannot treat a symptom and eradicate it from its roots. Just like I gave an example about malaria and fever. The biggest problem has been that the presenting complaint, what all parents identified first correctly, my bacha baat nahi kar raha. So for the parents, it is normal to note that. And it is normal for them to say, doctor, मेरे बच्चे को बुखार है, बुखार कम करो. But doctor may give a big lecture about typhoid. ऐसे यार वो छोड़ो, वो कुछ भी देने का दवाई दे दो, लेकिन बच्चे का बुखार ठीक करो. यहाँ तक ठीक है. लेकिन ये बोला नहीं, आप मलेरिया टाइफाइड का दवाई नहीं देंगे मेरे बच्चे को. मेरे को आप बच्चे को बुखार का ही दवाई देंगे और वो बुखार कम करके दिखाएंगे. ये हो रहा है अनजाने में, क्योंकि डॉक्टर भी नहीं बोल रहा ना कि नहीं मलेरिया मुझे मालूम है मलेरिया है और मलेरिया की दवाई ठीक है, स्पीच का करते हैं. और एकोलेलिया भी आता है ना, पैरेट स्पीच तो आता है ना. तो पेरेंट्स आर टोल्ड, अरे ऑटिस्टिक है बच्चा, कुछ भी नहीं बोलता, कम से कम पैरेट की तरह तो बोल रहा है, गुड मॉर्निंग तो बोल रहा है. अरे हाँ, लेकिन डॉक्टर रात को भी गुड मॉर्निंग बोलता है. अरे तो क्या हुआ, पहले सुबह भी बोलता था क्या? नहीं ना, अभी बोलता है ना. सी, दिस इज अ काइंड ऑफ ब्रेन वॉशिंग and bullying that parents are subjected to, which we have to understand that we have to break only by understanding that we have to break the symptomatic approach.
Somebody has asked a query with respect to a child they may know who's about 5.5 years old, and she's saying that the family doesn't have much time, but the mother is very willing to support the child, and so are neighbors. So I think your guidance to her would be to get in touch with one of your centers, right? She's asking for a
Absolutely.
direct guidance what to do.
Absolutely. I've shared the number here, so you
Yeah.
can.
Yeah. Vaibhavi, if you could copy paste these numbers on the YouTube also, then the people will come to know. There is a more general question, doctor. The person wants to know that how can one find out that a child needs special help? It's a more general question. I think she must be a teacher and wants to know that how to know that a child needs special help.
Now that cannot be answered in brief except by saying that if whatever you are doing is not helping the child match up with everybody else and you are struggling, then you need some help. This could also be because there is some parental conflict at home. Child is absolutely all right. Or it could be because the child is being abused at home. Or it could be because the child has a hearing impairment. So that it's not the teacher's job. And I'm saying this with full respect for all my teachers. आज भी मैं रास्ते में कोई teacher मिलेगा मैं पाँव छूता हूँ. Because we are what our parents and teachers made us. But like I said, I'm not a maths teacher. I'm not even a trained pre-primary school teacher or even a trained science teacher. It's not my job. I mean, I'm not an expert. Similarly, there's no reason for a teacher to behave that she's a developmental specialist, that she should solve developmental problems. Or a school is a center of developmental progress, of developmental disorders, that in your school you should start catching anybody and calling them therapists and forcibly making parents go there because you're getting some percentage out of it. So that has to change. If a child has typhoid and is vomiting, you won't say, नहीं नहीं मेरे को मालूम है टाइफाइड के लिए ऑन टाइम देते हैं मेरे डॉक्टर. आप पहले बोलेंगे माँ को बच्चा हो आपके मम्मी डैडी बच्चे को घर लेके जाओ वॉमिटिंग है बाबा. खुद के बच्चे को ऑन टाइम देंगे घर पे. स्कूल के बच्चे के साथ रिस्क नहीं लेंगे क्योंकि यू आर नॉट श्योर क्यों वॉमिटिंग है. Why are you suddenly assuming that we have all become experts in developmental intervention and starting resource rooms without anybody taking ownership and responsibility for it? I'm not saying it doesn't help any children. It does help some children, definitely. I'm not rubbishing it at all. I'm saying, are we accountable enough for it?
There is still a question on, you said that one of the things that we focus on the outcomes. There is somebody who wants to know what is the appropriate age to start pattern learning. So, though you did speak about it, that is something that's not to be done, but perhaps you could rephrase it.
After seeing the havoc caused by pattern learning, I would say never.
Yeah. Yeah. So you're not actually.
Just 1 second. On a serious note, if the child has everything else normal, has normal human engagement, good eye contact, responsive to them, likes being with the chachi, masi, can stay away without the mother, can adapt with the chachi, can adapt with the masi, can adapt with the friends, all the human part is all right, then of course you will teach. सारे गमा क्या है? तो क्या मैंने सीखा नहीं? सारे गमा मैंने भी सिखाया. But if he is not looking at anybody, he has no human engagement, he is all day obsessed with objects and just focused on objects, उसको pattern और मत सिखाओ. That's the point.
Yeah, that's the point that you're saying, is that the first step is to build the child's human engagement and then move forward. Yeah. Yeah. So is that something that you're saying? Is there something that okay, if somebody would like to unmute and ask a direct question, please go ahead.
I'll ask.
Yeah.
Dr. Dalwai,
Yes.
with all your, I mean, it's amazing the kind of work you have done. But what I feel is that you really have everything, the research basis, your 20 years of actual working with so many cases and case studies of success or failures or whatever. And I think this has to come to us in a form that is in a book where we understand how you have reached this theory of yours of how the intervention should be and what you have done, which is now proving to be very successful in your experience. So I really would feel that we need that book. Someone has asked also, I think, question that do you have a book which we can refer to? Someone has asked in the question, I think. And the second thing, I just want a comment from you as since in the education policy, now we're talking so much about inclusion, are you concerned as to how this will be interpreted and created as a part of the school system, or are you very sure and eager that this will take us to the right place?
I'm sure it will take us to the right place, but I'm sure this will not be done very easily because it is an idea which is a little ahead or a little different. And I have to I have to take this ahead with the utmost humility because everybody else is ranged against me. Because if somebody says something that goes against the grain and especially goes against a win-win formula, there will be many people who will dislike it. So I have no, I must say, however optimistic I'm doubtful how much it will be in my lifetime, at least it will succeed. But the hope is, if I'm sure what I'm doing is right, and I'm 200% sure about it, because I've spent enough years waiting for it to check it myself before declaring it. This definitely works. My only point is how to convince everybody and how to understand that there is another way of looking at the wheel, especially when what we are doing is working so badly. But I'm sure with all of you around, with support from everybody, I mean, nobody's criticized what I said. Let me put it that way. But implementing
Right.
is going to be a big problem. So at the level at which I can implement it from my team at New Horizons Child Development Center, getting that lot of people who are committed to this idea and taking it ahead. We are working now. We are working with pediatricians who are setting up online clinics across India. In their
Okay.
clinic, they are putting up a camera and a web camera and a TV. And we are coaching from I'm sitting in my clinic in Mumbai, and we have a team now. So we are coaching them online in the doctor's clinic. We can do that in the schools also. Because every child needs to, parents give only half an hour. When the parents come there, they can be made to sit in the side room somewhere with the camera on. They can connect to our team. And the advantage is the local school teacher or somebody is also there in that session. Parent will feel comfortable. One, sometimes there could be a language barrier because Hindi, English, Marathi तो हम बोलते हैं. Somebody wants Bengali, we may have a little struggle. So that local person can translate. And thirdly, जो भी सुन रहा है, he is learning or she is learning. So over a period of time, we are spreading the knowledge and training to everybody.
Wonderful. Thank you so much.
And anybody willing to do any research or wanting to collaborate with us, I was saying this, please write to us. I'm going to write my own number also. Anything in terms of a research study or jointly, I'm more than happy to collaborate.
Dr. Dalwai, one of the teachers is asking that what kind of tests or screening can be recommended by the school for a child who doesn't seem to be developing typically. Where should they send such a child?
Yeah, so the best place is to send to a developmental pediatrician or to some of us like who are offering this online as well.
Okay. So one
So
of
we
the
come out with the screening test. We have come out with the screening test, a New Horizons tool, which we'll share with you and you can share with all your members. They can administer that test directly.
Okay. So the teacher can administer that screening test, and if they find something is of difficulty, they can recommend to any developmental pediatrician they know, and if they don't know anybody, they could recommend to you, and you could recommend further if it is something that you cannot take on yourself.
Correct.
Is it?
Correct.
Yeah. So I think with such a lovely offer, I don't really think that people so willingly offer their time for guidance. So the least I would say to everybody who is watching is that in future, if you are confused about any child, instead of sending the child off to any which place or trying to do something in your own way, why not contact the 6 or 7 centers which already Dr. Dalwai is running, and what he seems to be promising is that if he cannot do it himself, he would be happy to put that particular family in touch with in his own network, whatever the developmental pediatrician the child needs.
Also, the physical centers. Now we are in our 21st year. We are starting the 7th center. If somebody has a space across anywhere in India, in your preschools or schools, and you are willing to give the space or share the space, we can think of jointly setting up some center as physical center as well. Both are fine. But
fantastic. So the doctor is actually saying that if any school wants to collaborate with him in setting up a center, he would be very happy to do so. I think it's a webinar of offers, and it really depends upon us which offer we can take up given our own enthusiasm. So the doctor is willing to help you through his center in any which way, and it's really for you to think what is it that you can do. Doctor, there is another query that I will rephrase it in a different way. The lady is asking a specific question, but I will ask it a bit differently. That is, are there any foods to be avoided during pregnancy which can prevent autism, such as foods rich in Western foods rich in preservatives? Should
No,
the pregnant, yeah,
there's no research to prove that either in the pregnant mother or in the child also. There is all these theories about gluten-free, casein-free. Only if you have gluten allergy should you avoid gluten, whether you have autism or no.
right.
So there is nothing, and the bigger shout out is all these nutraceuticals, omega-3 and DHA and all, they have nothing to do with autism. They don't change autism at all.
So whether you had them or you didn't have them, you shouldn't worry.
But
So-
last time in our nurturing care, we did say that the periconceptional diet of the mother is important, that she has the entire balanced diet of all the micro and macronutrients.
Yeah.
So better to have a balanced diet for the mother. That's
So,
important.
so the standard protocol, which we say that if you have a family history of something, of some sort of a genetic disease, then go in for genetic counseling. Otherwise, the best way is get your immunizations proper, take your
Yeah,
proper
absolutely.
food, keep yourself happy, stay out of stress, and don't unduly worry that this will affect or that will affect type of a thing, right? That
Right.
seems to be the
Well said.
closing line about which you seem to be saying. I think I have asked all the questions that were sent to me. If there is any question which I haven't asked and you know of, please unmute and ask. Or if somebody wants to ask anything other than this, please ask. Otherwise, it will be my pleasant duty to thank Dr. Dalwai. So I'll wait for a minute in case somebody wants to say something or even just comment. Okay, Dr. Dalwai. So I think Vaibhavi would have posted out all the contact information, Vaibhavi, onto the YouTube link so that people can see, or perhaps they can see it in any way. I don't know. So this has been just really a lovely webinar by you, Dr. Dalwai, where you have helped us to understand in a very simple way of what I would say to be a complex problem, showing us hope and possibility of a good prognosis for the child without spending money which sometimes the parents may not be able to afford, and without tiring themselves running from pillar to post unnecessarily. So I would say that schools who are really interested in working out for the children would be, it would be good for you to get in touch. Maybe the schools themselves could form a network, at least in Mumbai, and do something in that sense, being with the New Horizons Center or even with AECD. So with this, I profusely thank you, Dr. Dalwai, for taking out time and explaining things to us in your very informed, academic and rigorous way, interspersed with anecdotes which help us to understand things better. And grateful thanks to the parents also, whose videos you showed and who enabled us a peek in their lives. And grateful thanks to you. May I now say that the webinar is concluded, and thanks to all the participants for participating.
Thank you very much, Dr. Dalwai. Thank you very much.
Thank you, doctor. Thank you so much.
Thank you so much. Thanks. Thank you. I'll take a leave.
Thank you. Thank you.
Thank you, Dr. Dalwai. He just left. He could have waited. I think he didn't know that he could wait. Yeah, that's what I understood.